plans and protect yourself and loved ones. Need help and support? Please contact us at the hotline 311 Psychosocial Support at 722-6575 or 518-4157. Brought to you by PAHO, the OACS Commission, and UNICEF.
I can't
Good morning, everyone. Welcome to the show. It is March 29th, 2021. And I do hope that you guys had a good weekend. I missed you. I missed you. But like I always say, as always, it's really a good thing that we could come here, you know, and discuss some of the more pressing issues that we continue to have. And there is no, you know, there's no lack of it. And I think an hour, some days, feels like it's a really, really short time, but we're going to make do with what we have, as always. So for those of you listening to us on our partners radio station, that is Hits FM 92.1 and 91.1, good morning to you. Also, if you're watching us on social media platforms where we're streaming at this moment, I think we're on 17, 18, 21 different ones right now. YouTube is our newest, so you could go there, you could watch us on YouTube, on Instagram, on Twitter, on Twitch, on Facebook as well, and TikTok. I like to say that, TikTok. Okay, and also if you are watching us on television on channel 124, we appreciate it, blessed love. And like I said before, I hope you guys had a good weekend. We don't have much time as always, so we're going to get right into it, and we're going to deal with some of the more pressing matters as always. And you cannot talk about what's really the real issues here if we're not going to talk about healthcare. That is, and this is before COVID, we have seen people in hospitals on the floors, on cardboards, waiting to be assisted. We've seen how, you know, we've been affected by a lack of proper health care, and now we have to now deal with other issues like the privatization. And we have spoken about this many times before, but with the new developments, I think we need to take a look at it again, and we'll start from here.
Going to take a lot more money and a lot more time to fix up the current building and make it operational. So on the basis of that, I've now looked at what my alternatives are. And I've reached out to several different people. I've had ideas of my own. My cabinet has had ideas, in which I'm hoping that over the next couple of weeks that we can come to some kind of conclusion and make a presentation to the public of St. Lucia on how we're going to move forward. According to the report, that the current design in the building will not be able to deliver that. And that because the building is so spread out, right, from an operational cost perspective. And that's why I went to Cayman. I said, you know what, let me go and see what the difference is for myself. So we went to Cayman, same size, 104 beds. Exactly the same square footage, 100,000 square feet. Had 3 wings, and it had 1 big corridor down the middle. So the entire hospital is accessible internally. Where all the beds are upstairs, there's all pneumatic drops. You know what a pneumatic drop is? It's a tube with the air in it. So when they take a blood sample or they take anything, it goes straight down the pneumatic, straight to the lab. The whole thing is completely interfaced. In terms of where the billing is, in terms of the administrative side, all the support, it's simple. It is a quantum leap in technology that we're proposing to do, going from Victoria to OKEU. And who is going to run that and the equipment is a very critical assumption that we have to figure out. Because the worst thing to do is when you have new electronic equipment and you try to experiment with it, it means that the period of free maintenance that you would normally get on brand new equipment could possibly be short-lived. And it means that the $17 million would be even higher.
Babies requiring ventilation as soon as they are born or anytime after. Here you could see we have an incubator setting with our new market ventilators, which would provide ventilation for any neonate within the unit. And our timer. Our X-ray box allows us to dim and brighten the lights as we need to. And this timer we use to time procedures. Example, if a mom is bleeding excessively and we need to apply pressure, the doctor would ask us to apply the pressure. The doctor would apply the pressure and ask us to time.
When this is pressed, an alarm is set. The nurse, wherever she is, would know that a patient is calling. It is not a continuous alarm, but the sound will be made every 6 seconds and it stops. From the staff base, the nurse will see, she will see the room, the bed number, but she cannot reset from the staff base. She must come here to the patient and then reset after she have assisted the patient.
Standards of the medical profession in the country.
Our hands are tied for a number of years with respect to that.
In fact, if a Caymanian was to avail themselves to the promised training by Health City, they could not work in the wider community even after they got their qualifications there because they could only be licensed to that institution.
That is correct. That is correct.
So we've seen from the very onset a Prime Minister who has been very adamant about bringing Cayman here and privatizing. But in another sense too, we need to look at what this will do to people and what they feel, how you feel professionally knowing that you have done all this, you've gone to training for how many years, you are some of the more trained nurses out there, and you're here in St. Lucia, you're getting paid $3,000, maybe $4,000 a month, and that's being underpaid. And at the same level, at that same level, professional level in Canada, you could be making double, triple that amount, but you've decided to stay in St. Lucia and really go through the training. And then you have outsiders who are to come, and you are more trained than they are, but they have to now oversee you and what you're doing. And I think that must really affect a lot of people, especially the professionals. And I speak about nurses, but what about the others, other administrators, the doctors, others who've really been there and have had successes in OKEU, in the transition and everything else. And from the very onset, 2017, the Prime Minister has been adamant about this Cayman, and we have yet more fees, consultancy and other things to give to more foreigners to tell us how to do our jobs, because we are never, and to some people leading this country, will never be good enough to lead anything, to be in charge of anything, because we need to find millions to give consultants. And that continues to be very, very disheartening for me and for many others. And I think, when you think about privatization, to some people, it's just a word. But if you've had any experience going to hospitals, and I've had that with my grandmother, you go to St. Jude's, we've been to VH, we've been to Tapio, all of these things. There are, and you cannot deny that there's a difference when you go to Tapio